Manyaba awon kuna be magbodom la yi via ma vo de mia pala maseta iwe ba mele onupo moja lo la mia papa uma le india agbanye nke ketohia de heduma hia o yi kenya kwa manyaw ita ma vado ba mia srum akuda mia pala masenchi via to nye dolele manyeta nware ke gbla mucho miachi ekplo na mi na de etumie anya ba mia asrum chonchi le kamia wo achim ile kamia wo afi adoya magagblam le mechi aba magbato wono ita mi ejeya duga ta la apama na mundia amapapa ucho la masedo fama na make akachi south municipal assembly o papa gra mechi ndia mi adoja kuda di kana kudole lanchi alabe agbanya nkake ke kha godo wo lana kuda na na fodole ya chi adodan na magbato fo ma ko nkawe ya miawo afia chi dolele ya nuchi ha ta mi de mona matrova fama ma adanya mapapa afia mi ndie ke mi aida mi apa eje dodo aje la fama na manzi enye akono akpalu Rosemary Emma enye HIV coordinator na Ghana Health Service Akachi South Municipal Health Directorate ele afa manzi na ma kenye akono podo brabra ihanye technical support unit member na fa dolele ya le assembly ama Akachi South Municipal Assembly na ma ke akono Roslyn Ajiman akosua yanya HIV focal person le assembly ama yale akwamanji hakpede ntuzaze de kai keplodo le india Dr. Richard Kwame enye public health nurse ya ele akwamanam le india. Good morning ladies and gentlemen.
Good morning.
Miawezo lakenye maja kwa mcho kwa jitoje lakenye doyo fama mommy
doyo fama sama
akpe assembly mahadi Barbara. Everyone is fine. Markuna kokba ejina video. Okay. Ndia odumatoro maseva bota mi akwena mi na mako yevugba iga anogagana batami bona jeruga cho HIV and AIDS in alodi kana kudo ala bagbenye World AIDS Day egbenye khagodo nkake ko chia dari lan kudene nafa dolele yanchi no ba dolele ya denka fo mavie onye yesu sukate wo hia do ba mia anu fiafia wom alola mase dolao le agbongla vota no la mfiafia wom kude dolele yanchi ifa jedudu woge mie gbona le india ta bia agbanto e kama ya no kokom na nchu de kai kana le oduma apato Richard yenye no ba HIV alo overview nka tututu e wonye yesu sukate odo wona ya nyido Mr. Richard ma anogbo agba nye World AIDS Day nkakake wonye na fo mpire chunchi na mi
akwe na mo papa ya na egbe dinu wie bia ban ka gbanto a ye kika me kata ko do ani duna nku HIV dolele aji
okay
yo hala Akachi South pre assembly a mi ti mi akon keta aga awo nyonyo to karele ko kata me bo anya be HIV dolele a ele egale yo galaji egbe HIV a enye dolela de nye duko kata wo chodele me la kati hanyo mi chodele me
okay
ta ne enule dinu si he le nuka pepa ji alo he la gbele ji a enye be ma yo number le yifu be ma awo mi ade gon ruba abe ame 334,721 yo nyame yo le dolem eye ame 12,614 na yo nyame yo bu agbetu dolele ame
to HIV dolele ame
HIV dolele ame we bayi le Ghana
okay
le Ghana eye le pe ya me hemi pe ya go me hemi je a le pa mama ame 167,987 yonye ame yo he po dolele ale pe ya me
mayo ka ho dolele ale 2025 ya
2025 ya me pa mo nu e
afa ma pa mu fiafi mi na ngu gi
ame ma we po dolele ale pe ya me
okay Avo Richard nye machunya ale mu ina glomala afia ba dolele monya dolele ble konyo ta milan kunanchi afi majolego ka dolele ka tututu onye nkinye HIV ya and AIDS
okay HIV ya no be HIV ya enye dolo kutitiare ni kwana to otodo ple no bubu woman.
Okay.
I ain't dollar put the man of Grana now holds by Metel, I may not take a jiwa, Valeria, I go about is. You know, do is friend on me. Emma, yes, I do,
and not Jim. I fear by Nanya by HIV, a venue, ye, my what chicken, a dujioqua, not she de la manoa, Cavatros is. Okay. Madaka, Tayina Manese, Miesa Numa de Dale in Zia, play a lake, a dollar chong blame ye, let you come ha, a way a mamma 2025 year, a mayo kata canacona number a dollar le Ghana to come. Kwamia ide eje duduaji, a kama aga trova, a pame kamia allen kude enchi, magano bo coco. Rosalind, let me come to you. I want us to look at mode of transmission. How do you transfer the HIV/AIDS from one person to the other?
Okay, through unprotected sex and having multiple partners. Also, sharing of sharp objects like blade, needles, and knives, like anything that is sharp that can easily cut.
Yeah.
And also, from a pregnant mother to a child. It can be through pregnancy. Through pregnancy, that is childbirth or breastfeeding. You can also get it. And also, if you have STIs, it's very, very easy for you to get the virus. When you have STIs, it's very easy to get the virus.
Okay.
And also, let's say when a mother, and that's during pregnancy, during childbirth, the baby can easily get it. So
when the mother is having HIV?
Yes, through pregnancy, childbirth, or breastfeeding. The baby
How possible is that?
It's from the mother to the child.
Okay, so it's in the blood?
Yes.
Okay.
And also, you cannot get the virus if you have someone handshake, sitting next to someone, or even eating with the person. You cannot get it. Yes.
Okay. Tapida kwa Rosalind no numa de manobi ambe nena kwa dolele de laki mia wo afi akwila madengalo ano akhokho de laki unona ha ano numa de mbe nenya ba mia wo bododo eke yakacho eko bododo eke me protect me adoku me ze na nekel nenya bo la ma wa fi opri me do ala bobu ibe na pinchi akhu nena kwa dolele aga de jesi ha be nenya ba dolele le madem yo ze mu si amada ba blade plan of yaw eke woshi ye wo ha na vachoma eza na manya shiokwa ele bobu ibe na tia ko nene kwa dolele ya aga deje si ha ba nenya ba jila nyonu adali eke afule si alofu fuye dolele ya levuma na jila ma ele bobu ibe de vima eke jigole a nya ba levuma na dada fi ochofo ipo fueta de via pa dolele hohwa ya anu bobu ide kwanya na no yoka unon kulem denchi don kwaji bagbanye World AIDS Day alebe ofa agbongla yoka de nang makuda dolele achi wowe el apama. Brother, let me come to you. What are some of the symptoms?
Okay, so within the first 2 weeks to 4 weeks after contracting the virus, what happens is that you begin to experience symptoms like malaria.
Okay.
Having flu-like symptoms like fever, fatigue, tiredness, muscle and joint pains.
Okay.
Diarrhea, night sweat, etc. So if you don't go out to test, you may think that it's just malaria. So you just walk to the pharmacy, get some medication, you take it and you think you're okay. It will come back again. So you'll be there and then you think, oh, it's just malaria. So if you don't take the right step to go and get tested, the HIV/AIDS advances to become AIDS, where it has gotten to the terminal point. Okay. So at that point, your immune system become more compromised or weakened. Okay. So it can't fight off infections.
Okay.
So what happens is that when it happens, now the symptoms become very chronic.
Okay.
You are from the acute stage to the chronic stage. So you'll be having recurring infections, cancers.
A lot of things,
rashes,
diseases will be coming.
Exactly. Rashes, and then persistent coughing. Yes. So your diarrhea will become chronic. Severe, and so we advise that. I know that we all know that getting to test is scary. Yeah. But you want to use this day to encourage the public to master courage and walk to the facility and get yourself tested. Okay. When you go to the facility, you are assured of confidentiality.
Okay.
The health professional doesn't have the right to disclose your status to the public.
Are you really sure of that? Because
Yes,
these days
yes.
it seems that kind of confidentiality is no more there.
So if you're able to report, it's a criminal offense.
Okay.
Yes, you could be jailed.
Mm.
Yes, so if the health professional goes and disclose your status to somebody and you get to know,
You can see the person.
Exactly, yes.
Wow.
So please walk to the facility, master courage and go and get tested.
Wow.
Better late than worse. I just say sorry, yes.
All right. Thank you so much. Ta brabra no madam no biamba lekimia wafi dolele ya miachi emuha. Alebe aw no biamba kawe ya mia kpo de jesi nenye be dolela le madanchi ha yo kanye jesi de kavado. Alebe no fa no madada de jesi be nenye ba made hu ne kwa dolele ya HIV isa nenye ba made hu le kosira de kava mo maina akweba na no ano modom dai ke ama obaka fi vailiene ekpekpekpekplengu kpekpekpekpe va me kple noviawo mu katanya na ne yo ke anomodom dai ke na twebe de uma hia malaria ifudem ni na no dujia yi de pharmacy alo drug store ava iple chike mananya ba na zie azundo ga nyi vire ga kama jijigo kwa ga trobo ala be manya malaria ifudem na uta amu khlo ma joja be na wanyoa jegbagba na wi yo ton bi ponko na liko kpekpekpekpe vam aba fi veji be adefuno na nanu akpakpan kplemo katana lo ngochima na kplemo wa jagba na va koji ke na va o dodokwa HIV fa dodokwa agaji de jesie be dodokwa ma lemo be amagedo no vovom na wowo akeji be akareji na miakata be mi jagba mi va o dodokpo ye nenya be na o dodokpo ha kakareji blibo toli be nwika adochoma odeka ikwenya mai kesege donoji polo ma mage ple amadeke babra gaden ma ha be nanye bo va joba o dodokpo no HIV tester yo kpo nene kwa dolele ya lenchiu yo va zuba ku donoji polo ava igbele na mobubu ade o ha cho o haloi anu jijim na ole podomia amode de lifa dada seji wonye be na cho donoji polo ma cho ide koji ela be enyama akwimanye wonye na wode kajako amode de malibe o mikle amadeko tamino TV agbomia aide eje dodoaji. Now we want to look at some of the preventive measures and then treatment. Madam Rosemary, please let me be with you. Manobo, amiado hoga.
Akwa miedo agbanti na mi afanya sola. Yakbo ale mi awo akochi dolala.
Yeah.
We have alphabet aro mi gbona ba ABC.
Okay.
Yeah, enya abstinence.
Okay.
Na mo do wo yi ko magawe.
Magawe.
Na mo nyo ina afokujaga.
Okay.
Babali amieba be faithful to your partner. Na ukakula madam yeli ko mito nyata ko na mi ana. Magano awere ka kumu. Na we kuma ina jogwe be kpanga. Atolia ikenya siya. Never correct and consistent use of condom. Condom ai kenya ngwike na tanza $100. Tana zam ha sakla rodo la ngale na zanga la bana follow na zera rodo man.
Ema ba ma bia ba correct ade lucky me oge majiba na agbakpa mama. Manyero kuna tue kwa aro lucky oge.
Agba na be azia ala bana kubo ba ya koloshi. E check condom ma expiring data ma expire. Na check e kwara ba duwara kama ngora fiara ko. Amiara lang na lila shiro baji ko ba didim na ko ba amilang amimalang afi na zin ala ba na ko ba papa via acho ajonyu
okay
afi na rogani na duya na alla nu bo fia ka nya lobo e pa mi antuchi akokogoro alla garashi afi na tutu kaka ko ba ira gomani
okay
na manira shiwa ai ha ga brother papa bia ko nugo ba na chi adu amati kokogara fa fi mo lobo ko chi ai ma
okay
ta da lagara shi afi anu tutun kaka ko ida anu fa
okay apa marko ida social jina
ta ala ba na no zam shi ai mazaga gba ato na dia kubo ato hoga tana abi azin ko ala ba na azin eji
okay
ga kpara ha ma nwa amayo ka no nranwu zama ba to ni blade la to ma wa mala advisable
okay
ma shia ma na ji fa amayo ko no fochuwo ma globa ma shia ma na ji fa fochuwo mu okodara loji na mara na ina da fochuwo pa na ko itafa ozenu ata popo ha no to temple machine Adamia je la ba magara o dana sterilizer afima ga kama do
mu
ta ya camouflage ko ita na ajiu no ma wo adajiu na yi ha na gbogbo sterilizer do wo make machine na malushi afi na kota la tafa
okay
ga ko pere ha ma mi ha bu do mi bu na ba post exposure prophylaxis
okay
abata flachi accident ara jofia ko na zora ma ji be ko ma bi la shino o ku chaka vua na famia ko mi adaura chika jinji mu da kako na la ba manya la mango ro ma la mango tani mi daura jinji mu da kakwa kavu na la mango aka ma fogo kama ha la ba na vakaba ala ba nkaka tokwi na ma vara nkaka to maji ko na nya ba maka do wogo afi da kara mi gba ba pre exposure prophylaxis ya na ba nchukula nyongo la ma da kanwa mai ka malo a chika nuga afi o ka plus ro
wado okay
o wana na ma protect amada ka ba ma ga foto iha alifia baba ga kachia iha mie ba kwada ga chonchi na ba do kwa
okay
afi afu no ha na fofu na ba koji ka ba la ba manyana le nwo ro ma le nwo la ba mo protect ma ha mo na fu fo chi akora la manota ala ba na gbogbo ba ye ba koji ka ba okay na mie do ko la nwa ka mie dora chika ji ba na de fia ma ga ku akana ma vaka bona la forma do hina gba ba ji fira pa ma de vi ma ado hoga ye wo chika no no go ma jaga sare gbe na ji ba sare ye pa ku ya mo yo ho no fi ha ma ko ma mi ada kuku no ba no wo yo ha de vi a no ja gba no ji a shi wi glove no do ala ba me na bia kam na manya nke dola ke la mu na ma ga ba ko dola manya mu ta la se nya ba ma sia ma na ba ododo po na ododo po anya ma feli na la nwa ma guma ko mi daura chikaji kakana ma la nwa ma fiamba ma la nwa ta na yi bodo ma be no gbagblagla mu ye ji nwa ton ruga nu na ga to wala ba na ma ko teti ma jeje ga
okay
ji nwa to baba ga mi aga we ye blogo no ba ma ga mesa ku ma ga na be won gbagbla da ku na la ba na ru ki o ji nwa to ma gba ma ga baba ga ji nwa ma to nya ji nwa da ta ne mi wo ji nwa da ma la nwa ka fiaba mama ma la nwa ka mi aku no ba na la ba na ru ki o ba ma ga foto
Mr. Richard Mavagagbo, Rosalind Ma Anogbo, let me be with you. If someone comes to the health facility and that person is being tested and it's confirmed that he or she is having the disease, what advice do you normally give these people so that they will not go maybe thinking, I want to kill myself and all that?
Before that, I know you have to go through counseling before you get a test. Before you get tested,
okay,
you have to go through counseling, so that prepares you psychologically.
Okay, you are ready for anything.
Yes,
okay.
Yes. So it makes it easier, and after testing positive too, you go through another education. So, like, you become prepared for what's ahead, and it's not a death sentence.
Okay.
So you just have to take your medications, stick to your medications, then do what you have to do the right thing.
Okay, so the medication, is it something that you need to take on daily basis, monthly basis, or Mr. Richard, I think you have to answer that one. Achika de bejagbe inji ndofia lo jimusia jimu yo jabana no mi lucky or no na majibana kokwa ma no mi fida ko
achika de be shadow ko le na
bejagbe
le nka dodo ni to me
okay
ni toji
okay
apo do ko la be ameyo hypertension low diabetes lo ma ko na achika be shadow we do not want to share with you.
Yeah.
That when you bird and your hot dog. I said, come up, you firm to do a party out of tonight. That we share the one. I probably not teacher. I got done the curriculum. Quatica and another Lenabu. And Babu, you are the way. Who started to make an always you. Yet I will never number like Tika Jinqua. I heard with your love go for purpose. I will bury a fear. Umatonga gere ufomu kwa. Do ya na ma head wo bodo mega to ko do la ko na. Okay. Ya di banto amejoma ado pe tumetinya dia wo.
Okay, team okay, ado pe jina
the team for the celebration.
Okay.
Overcoming disruption and transforming the AIDS response.
Okay.
Overcoming disruption
transforming the AIDS response. Okay.
Nuya enya bromolo konyebe akpobe jirudua tolele gede anu gede le jirudu so do da ho so be COVID-19 peto ma hova doko abe mimro HIV abe ni mega leke nyonyo ma ke no me wono papa de peto makata jiri buwa de ko ba obe de mimu le be dia ko ba na be to le ya ba le eji ma le gbe le akachi ha la fi ha eji ba le gbe onye do le mu ra me ke mo ngono ta le be na ba yo ji to pa na to nya be to le ya le da ni igbo mi le nye ju ye be jiri bu na gbo tro aside aliko ko nku yo ko pona HIV ya bele ka fe nyaume bele atike na na fe nyaume be bubu do fe nyawa jiri na agbo nyonuma be ni aton do bubu sponsor so no va sponsor abe program ya wo mi la sponsor so wa ton sponsor ni be ni aton va TV aba de HIV play fe nyawo me na magede go be knowledge is power na te unya nu yoruba na wo kwa anya ke na azo.
Okay. Maga no bo afi mava your sister obo komatro na mo mijimi anota ho. Let's talk about stigmatization. Amumova na kodi ava no complaining. Nanye be wo dodo poko ko iba dolele ya lonchi a. How does the public accept them afterwards?
Okay. Da nyama hebra nya bebere woni. Akwa mbesi ambenya na yola na ro woni ne. Dolele fe nyawa nya woni. You become more vulnerable when you are sick. Na jedoa kama akpo gbare hu Governor Lea, Matan one of the cool. Yet I was over near Koji dollar or missionary nursing confidentiality. Yeah, confidentiality. Clients are for confidentiality. Ne clients are made the more by not Branyare Kato if to alone come uncle. Yet I was over ne nurse. Alone your Koji dollar who was over a wound born or now. When I have Brahma Yare, what's there? Sia a probably. Na mamma, Baba Bonami Yabe, Ozube, Amere, Bag Branyama at the Paria, say a Yakwa say a cosgo. Yet, nay, councillor, me the Amissian governor. Okay, Bena, I did Tidani at the two councillor. Upon no Zube or what Tesla Puma for former Lemoa. I told whenever called you councillor, and the councillor, you are informed. Okay. Yes, I can still for the I to Abrano ha. I never would you. I did. I imagine the folk well and what a line Kakia, let go bring me a digit. I know the devil. Yeah, no, quite do allow me get it. But me up. I don't know if I'm going to for a call yard near back. I don't know. I don't say near the crew. I got back. I buy it. Yeah, well, it's you. Yeah, you can't get it for now. But I go back when you were a Kayo. Eh, I'm a suburb. They were a Kayo. I'm all a mezza. Daniel was obey if I never to lay in one. I don't do this. I'm a Yokata, command Yakata. I was a pretty friend of Yakwa. I mean, we are moving on.
Okay. Rosalind, I want you to be real to me. Let's say you have a friend who you used to move with, go, come, you do everything together. All of a sudden, that friend happens to be an HIV person. Before that, he or she is not an HIV person. I got to a point that he or she contracted the disease. Will you feel okay with that same person, how you used to be? Just be real.
Of course, because I understand what the person is going through. Okay. And I have an idea about the virus. So it will be easier to relate to the person. And that's the main reason why we are doing this. Okay. So that you don't cut the person off, you show the person love. And
it will not be like the first, I guess.
Oh,
Barbara, the same thing?
No, yes.
You also feel okay about it?
Yes. So this is a time for you to show them love. Yes. Because if you don't do that, they will go into depression. Okay. Okay. So you don't just scare them away, you draw them closer to you, show them the maximum and support if there is any for you to offer to the person, you should. And the most importantly, the love. Wow. They need it the most. Okay. Yes.
All right. Tak pida kwa mie no jedom cho di kana kudole lang alebe manobia biambe nanye ba made okli me yina bona ko jogba vito me ava kudole le made ali ka mie le chade ega no gane maha alebo no mede na bo the micro jeba na delonlo afie novia e ke okli kadudu nwito na no miadum plus bo ma ga woni bo ka dole le ava va yenchita ine va tru magbede yo ala bele yi moma o hia ne lolo manya ba mia no je chiama jima ana odemu Mommy Merku ana unyama me afi matro de for Richard Bowa afo etana de line be a chopia
akpa na mie stigmatize ama mie shim na ma bo ho ana na ba ma do wo na ko susu ba ye na maga ala ba
ya vai kaki
ye na kakaga ala ba ye ha do hi manya gbodo do me ya ko do ni
ya ma di
ma na na ejo ya ku ta na ona na ma mo wo na ko susu ba o kai ha ya ba mi ta ma gbolo ba ni chono no nu ma sha ma na no wo ha o danchi
okay
ata ma sha ma ta ko dola
akwa for it ada ko nya ta na onya mamle e ka gba nya World AIDS Day
yo the Congo ma globe ka ma ko nyata a globe nenye po nya be statistics wa e ba je fia be nyonu a wo kodo wo
ntu oh okay
aka manye go nya be nyonu we plewulo alo na reke ne ma wi ko le wonya be akwa mia ntu a nenu amala leni wanyi wa me nyina koji o nyonu wa kaka na de nya de funa kwa okuti koji ta ozube na ma ba koji a to kporo mi wa de echa de to kwa hana ma kama e na be wo number asugbo ye ni mi nya gro nya be HIV a menye ne kwa HIV a menye akupe nya onyo ne do to akufia na wo HIV a de ko la be hypertension diabetes ko to le bu yo kata le na ngbe to kwa ne ma ko HIV a le
okay
mi yo le wo ko nya be na I take responsibility. Health is a personal responsibility. Mohana jagba award to po. For what pobere to le ale wu alo mele wu. Ya me yo nho le na popo be yo nuka. Ye no atike le dodo mi ale bana de ko kwa. Kemi ate wo woni a DTHIV pe nya wo le Ghana.
Okay, Rosalind, just a quick one. The test, is it free, the HIV test, when you come to the health facility? You not pay anything. Okay. So what about some of the protectives? That one, do you give it free?
Oh, yes. We have
condom.
So
yes.
On Saturday we had a grand deba.
Yeah.
And we distribute a lot of
condoms
out. Yes,
oh, I see.
4,000, more than 4,000. Yes.
Wow.
Yes. So this is the last one remaining. So.
Oh, okay.
It's for you.
I'm
after the
taking
program.
Akpa kaka. Mi abono kola manoje dunkle amadodocho Akachi South Municipal Health Directorate. Nene make Akachi South Municipal Assembly. Team of ewo na do ashila shima akpogbo ba you afie no juaja adenu makude dikana kudolele anuchi. Ta agba ikenye nkaka godo fa nkaka wo azaya dume ike afie no juaja wola kwa mona mundi eke enu madama kareji ba miese nu gadama ensosro gadawo ijinje ba vieto enye ale kamia wafia prevent alo achi dolele anwa oglo gadele ndia emiese gomandia habe HIV and AIDS manya fuka wonya na dedega kona dokyu na nyeba na kodolele ya ta na nyeba da flachi na mia pom lendia dolele ya lenchio mama gawe ba na chi jojojo la dokyu mo oglo na mifia ba ajeba na no chika nunde dodong ele ba na za chika ode dodong emi amayo ka da flachi na mi na bododo fa ajaba mia protect mia dokwi mia aza da flachi condoma ye madame Fiemile kojeba mia aze plemmo kwa eleva vida ta anyoba mia cho de lema ala ba dikana kudolela anye dolela de ke nanyeba ovaje hoton ne wo ka ebona nyino ga kpli otegbe ala ba manwonye ka chuchuga gba ajo ina olikulu na ma achichiga jojojo le dokuyoma aha wonto achiba ye kota gbaja choma hala no me yesesemvo ina le ga no susubumcho anchi tamije baba mia o de sekle do auji ka wi ba dolele ya maga de funami ama yo kakpere nchinye ndi ya fiami mu ikami espa azaya dumalo ka godo nkudodo ji wona ya womne dikana ku dolele a yenye apoto Richard enno akwama nene make aponozazi Rosalind ha enno akwama nene make Madam Barbara okata wono akwama hakpede Madam Rosemary nuchi kwa owipede nchinya wale kama dongo glina Madam Rosemary Akpalu Emma yenye HIV coordinator ne Ghana Health Service Akachi South Municipal Nenamake Barbara Kodo inye technical support unit member le Municipal Assembly ama alebe Ajiman Rosalind Akosia yenye HIV focal person le Assembly ama afi abato Richard Deti alo Deti Kwame aha yenye public health nurse to Akachi South Municipal Hospital. Mother, please thank you so much for coming, ladies and gentlemen. Akpa kakaba yevakpa accident. Tala banedo kuyo e na ina bodoga je bagba ikana a protect the ala badi kana pundolele a ma enyo ga kare Mr. Richard kafu jesi ada no nya do my marga be se no mo kokoda la bagbe World AIDS Day oba you ga further info about this education kafu jesi ada no nya kam ya
ko mo bele amata ako nyo kafu jesi ko dana ni
apa adedi fa
asenare ma no ton yomi
apa
mereko kafu jesi anye 0246
afna ko camera ya makuna na aye no
kafu jesi anye 0246 84 1815 0246 841815.
Kakopara hama 020 4484 823 020 4484 823.
Apa ba mi va para unye ka wo mfiafia ya ata pagare da ge ka o pagare miam anko nyenye sedem Timothy Hamilton mi pa wana so se okata emi agodoga